this side. This anterior, this is the posterior. Okay, you are seeing the right breast. You are seeing this view. Okay, so we take a section like this. This is sagittal section, and this here we have lungs. Okay, so this is the layer separating the fascia, and here we have ribs. And what you see, this pink one is the intercostal muscle. So in front of that we have two muscles. This is the clavicle. So below the clavicle there is a muscle called subclavius muscle, and below that we have one more long muscle. This is called pectoralis major muscle. So in front of that the breast tissue is situated. Okay, so you can see lots of yellowish mass and pinkish mass. Okay, this yellowish what you see is the fat, that is subcutaneous layer below the skin, and what you see the pinkish mass called as gland lobules. Gland lobules. Okay, they all will converge and come towards this nipple side, and this what we see pipe-like structure. This is called as lactiferous ducts, and it opens into sinus called as lactiferous sinus. Okay, and this fascia what we see, that is in front of this is called as in front of the pectoralis muscle, and this is called as pectoralis fascia, and the breast tissue is attached to the pectoralis fascia. This is about the anatomy of the breast tissue. Okay, that is okay, and this will increase in size during puberty, and it will increase more in size during pregnancy under the influence of progesterone hormone. Estrogen hormone will help in the proliferation of breast tissue, whereas progesterone helps in the development of the lactiferous glands and the secretion. And also one more hormone that is helpful for the production of milk is which one? Hormone from the pituitary. From the pituitary, prolactin. That is from the antropituitary. For contraction of the breast tissue during breastfeeding is oxytocin. Oxytocin. Remember that is a hormone, physiology one. Okay, that also I told you now. Now come to the blood supply. This is a breast tissue, and I told when it develops during puberty, it starts developing more, and it becomes enlarged during the pregnancy. Okay. Now come to the blood supply and venous drainage. So whenever we tell blood supply, it involves both blood supply and drainage. If they ask only artery supply, you should write only artery. If this venous drainage, only veins. If they tell blood supply, means artery supply and venous drainage. Come to artery supply. Supply number one, subclavian artery. The artery below the clavicle is called subclavian artery. That gives one branch called as internal thoracic artery, and that gives one more branch called as medial mammary branches. Coming to this breast tissue is also called as mammary gland. M-A-M-M-A-R, mammary gland. So first one is subclavian artery, gives a branch called as internal thoracic artery, and that gives one more branch called as medial mammary branch. Branch number one. Next, second one, axillary artery. When the artery passes from here below the clavicle, your arch of aorta gives branches below the clavicle, subclavian artery, and when it comes to axilla, it is called axillary artery. So axillary artery, when it is coming down, it gives one branch called as lateral thoracic artery, and that gives lateral, that supplies the lateral part of the breast, this lateral one. Then we have one more branch called that supplies both thorax and acromion process of scapula called thoracoacromial artery, and that gives the posterior branch here for the breast tissue here, or also we can call it as pectoral branches. And the last one called as posterior intercostal artery, that supplies a lateral, supplies skin of the breast, lateral cutaneous branch. I'll repeat once again: the blood supply, subclavian artery, the artery below the clavicle gives branch called as internal thoracic artery, and that gives one more branch called as medial mammary gland that supplies the medial part of the breast. Axillary artery, which is a continuation of the subclavian artery, comes to axilla and gives lateral thoracic artery, and that supplies the lateral part of the breast. Thoracoacromial artery, that is also a branch from axillary artery, and that supplies the pectoral branch, pectoral region branch. And the last one is posterior intercostal artery, and that supplies the lateral cutaneous branch for the breast. Whereas The venous drainage is as follows. The blood is drained to axillary vein, intrathoracic vein and intercostal veins. That is the drainage. Okay. So just pause a while. I'll write for the lymphatic drainage. It's very, very important for the breast tissue. Lymphatic drainage. So I'll retain the most part of the body, especially the left part. Okay. Up to the upper thorax and left part of the head and neck and left arm and whole other part of the body is drained by the left lymphatic vessel, that's called as thoracic duct. The right arm and the right part of the head and neck is drained by the right thoracic duct. Okay, so in the breast topic we have to study about the lymph node, because if the breast has got carcinoma associated with the abscess, I want to rule out, I have to take lymph node biopsy. Mainly we will take axial lymph node. Sometimes there is also possibility of the cancer cells spreading to cervical lymph nodes. Possibilities are there. But usually we take the biopsy of axial lymph nodes, and if I find if there is any cancer cells, then I can relate to the breast abscess is because of the carcinoma. Now, if a patient has BRCA1 or BRCA2 genetic mutation, is one of the reasons for breast carcinoma. The other reason may be he might have taken radiation for some other condition, and that is one of the reasons for breast cancer. Then one more reason for breast cancer, very, very important, is patient might have taken oral contraceptive pills, especially the estrogen component OCP, combined pills, what we call it. Estrogen is a proliferative in nature, and that is one of the reasons for breast carcinoma. The other reasons are low socioeconomic status and other things are risk factors for breast carcinoma. Even smoking, alcohol, all those are risk factors for the breast carcinoma. Mainly this. One is family history will be there, or the patient may be having the history of taking OCPs or radiation. These are one of the few causes of breast cancer. Now when you rule out these causes are not there and the lymph nodes biopsy is negative, then now come to lymph node. So lymph, what is the function of lymph? Main function, whatever the artery brings, usually vein should take. Especially the artery is the one which is involved in the bringing of what? Oxygen, nutrition, and veins is the one which is taking back the carbon dioxide and waste products. But some particles will be bigger and that cannot be taken by vein, and it will be lymph. Okay, and lymph is also having a role of immune system. So usually when the cancer cells are formed, the cancer cells are not actually extra cells. Our body cells has lost control over its cycle, and if that cancer cells is coming towards or draining through the, because we have three types of spread of cancer. Any cancer will spread by three ways or routes. The spread of cancer itself is a short process. Direct spread, directly it can spread to neighboring structure, because your breast cancer may spread to neighboring structure like lungs or even the heart or any other neighboring structures, or it can enter the blood vessel and spread through blood. We also call it as hematogenous spread or blood spread. Most commonly it is spreading through what? Lymphatic vessels, called lymphatic spread. So whenever it spreads to lymphatic, it usually affects the lymph nodes around the axilla or cervical. Most commonly it is around the axilla, and the first lymph nodes that get affected because due to cancer, and that is called as sentinel lymph nodes. And as the number of lymph nodes gets increases, we are going to stage the breast cancer as TNM. T stands for tumor, N stands for lymph node, M stands for metastasis. So tumor is what here? It is the size of the swelling tumor, less than 1 centimeter, less than 0.5 centimeter, more than 1 centimeter. So we are going to grading the tumor based on the size. Lymph node, how many number of lymph nodes are involved and whether it has spread to distance organ. So if I write T0, N1, M0, so tumor size is not much increased. N1, one lymph node is affected, and MO means metastasis is not there. If I write T1, N1, M1, then tumor size maybe around 0.5 mm or centimeter. Then N1 or N2, if I write also 2 lymph nodes involved. Then M1 metastasis present. Like this we can, this is called as TNM staging of cancer. We also can grade the cancer as grade 0, grade 1, grade 2, grade 3. By taking the TNM only we can grade whether it is mild, moderate or severe or very severe or spread to different organs. That's called grading up. Usually grade 0 is easily treatable, but grade 2 or grade 3, grade 4 is it has already got distance metastasis and affect the different organs. Then we have always the treatment option. We have chemotherapy, radiotherapy, surgery, and palliative care. This is the 4 point for any cancer treatment: chemotherapy, radiotherapy, surgery, and palliative care. If the cancer spread to different organs, surgery is of no use. Whatever you can remove, you can just go for radiotherapy and chemotherapy. If the cancer is very small and is very restricted to a particular region, you can go for surgery. And if you think that still the complaint is not cured, followed by you can go for chemo and radiotherapy. If a patient is terminal illness, you can't do the surgery, then go for chemotherapy and palliative care. Radiotherapists will not advise if the patient is advanced age. So these are the treatment options for breast cancer. Suppose if you feel that the lump is very
breast
small,
conservation surgery. Yeah.
So if you feel that you have to retain the breast tissue, you can just remove the lump along with a surrounding normal tissue also. Why? Because you may suspect that some of the normal tissue also may be getting affected with the breast tissue, so we can remove the about 1 to 2 mm of the surrounding tissue with the lump also we can remove, retain the breast tissue. But if you think that it is spread to whole of the breast, we do again a surgery called as mastectomy. Mastectomy can run. Sometimes we also in abroad they do called breast reconstructive surgery. That also they will do, so that the shape can be maintained. So that is about the treatment option. If it is a malignant carcinoma, there is no other option to maintain that. You have to remove the breast tissue called as mastectomy. So that is about the breast tissue. And thank you. This is Dr. Chandrashekar signing off from the program.